Some people thrive on intermittent fasting, steady energy, clearer appetite signals, and gradual weight change. Others feel fatigued, hit weight plateaus, or notice hormonal stress. Why does the same protocol produce opposite outcomes? Metabolism is individualized. Understanding your biological response matters more than following trends. This is a long-form, evidence-based overview designed to remain relevant, clinically credible, and neutral. We will focus on physiology, metabolism, endocrinology, and nervous system regulation. Core objective: explain that intermittent fasting is not universally beneficial because metabolic responses differ. Learn how to identify whether fasting supports or stresses your physiology. This is a decision-making guide, not a recommendation. We will cover intermittent fasting benefits and risks, who should not do intermittent fasting, and metabolic flexibility explained. We will discuss the fasting and cortisol relationship, fasting and thyroid function, and why fasting stops weight loss in some cases. Let's begin. After a meal, insulin gradually declines as glucose is cleared and storage signals ease. Lower insulin reduces glucose uptake pressure and shifts signaling away from immediate storage. The pace of this decline depends on physiological context, including insulin sensitivity and recent activity. Next, the body draws on glycogen in liver and muscle to maintain blood glucose. In healthy regulation, glucose remains stable within a narrow physiological range. Glycogen duration varies between individuals based on diet, training, and liver size. As insulin falls, lipolysis rises, supplying fatty acids for oxidation. Metabolic flexibility is the ability to switch efficiently between glucose and fat oxidation. This switch varies between individuals and can be trained or impaired by lifestyle factors. With fasting, counter-regulatory hormones like glucagon, growth hormone, and catecholamines rise to maintain fuel availability. Cortisol can rise modestly. In context, this can be adaptive, but excessive elevation may signal physiological stress. Thyroid signaling may adjust to conserve energy if the body perceives a sustained deficit. Autonomic signaling shifts. Some experience calm focus, others a stress-tilted response. These processes can enhance metabolic flexibility or trigger stress, depending on the individual. Metabolic flexibility is the capacity to switch efficiently between glucose and fat with minimal symptoms. Flexible metabolism preserves performance, mood, and appetite regulation across feeding and fasting. Short fasts can serve as an adaptive response that improves signaling. In stress-sensitive metabolism, fasting elevates cortisol, reduces thyroid signaling, and conserves energy. This can feel like fatigue, cold intolerance, and slowed progress. Success with fasting depends largely on this distinction. If signals trend flexible, fasting may help. If stress signals rise, modify, or pause. This is personalized nutrition science, not ideology. We now explore why results differ between individuals. Key modifiers shape hormonal signaling during fasting windows. Context is the mechanism. Sleep quality modulates insulin sensitivity, ghrelin, leptin, and cortisol rhythm. Better sleep supports stable glucose and calmer fasting responses. Chronic stress elevates cortisol, shifting metabolism toward conservation under fasting. High stress plus fasting can compound strain for some individuals. More muscle mass improves glucose disposal and fasting flexibility. Training with adequate recovery supports metabolic health during fasting windows. Baseline insulin sensitivity shapes how quickly you transition from glycogen to fat. Those with reduced sensitivity may experience slower or more symptomatic transitions. Circadian rhythm alignment influences glucose tolerance and hormonal timing. Aligning intake with daylight can ease fasting for some. It varies between individuals. Nutritional adequacy, especially protein and micronutrients, supports satiety and thyroid conversion. Chronic underfueling intensifies stress signals during fasting. Together, these variables alter hormonal signaling during fasting windows. Context governs response. Fasting often benefits those with stable energy regulation and healthy circadian rhythm. A low chronic stress load and resilient nervous system response help. Adequate protein supports satiety, lean mass, and thyroid function. Intermittent fasting can improve insulin sensitivity by reducing postprandial insulin exposure. Regular structure can stabilize appetite signaling for some individuals. With recovery, fasting may support efficient fat oxidation and overall metabolic flexibility. Outcomes may include modest, sustainable weight change and improved metabolic health markers. This aligns with safe fasting duration practices and circadian rhythm and metabolism. Signals steady energy, stable mood, normal sleep, and preserved performance. When physiology is compatible, fasting can be a useful tool. Always consider the individual and the adaptive response. Excessive fasting duration or poor recovery can invert benefits. Elevated cortisol patterns may emerge as the body protects blood glucose. Reduced thyroid conversion activity can slow metabolic rate. Adaptive metabolic slowdown is a protective biological response. Lean mass loss risk rises if protein and strength stimulus are inadequate. Increased hunger signaling can follow prolonged restriction. This is not a failure of discipline, it is the body defending homeostasis. Why fasting stops weight loss? The system adapts to conserve. Adjust by reducing fasting duration and improving recovery signals. Some populations should avoid or only use fasting under medical guidance, depending on physiological context. Personal medical history and medications matter. Responses vary between individuals. Extending fasting windows too aggressively invites strain. Escalation should be gradual, if at all. Combining fasting with high-intensity training can amplify cortisol and impair recovery. Match training intensity with fueling and sleep. Breaking fasts with nutritionally poor meals blunts benefits. Favor protein, fiber, and micronutrients for stable signaling. Over-reliance on caffeine can mask fatigue and raise sympathetic drive. Keep stimulants moderate, hydration steady. Ignoring sleep and recovery variables undermines outcomes. Recovery anchors metabolic signaling. Common errors amplify physiological strain and reduce adherence. Start with moderate fasting windows rather than prolonged fasts. Choose a safe fasting duration based on context. Monitor energy, sleep, mood, performance, and appetite. Look for steady trends, not single-day noise. Adjust duration rather than forcing adherence. Emphasize biofeedback over rigid protocol. Treat fasting as a tool to be calibrated, not a test of willpower. Continue if it supports function. Revise if it stresses physiology. For clinicians, use simple language to explain metabolic signaling and adaptive response. This is personalized nutrition science applied to daily routines. Start moderate, monitor, adjust, and calibrate. Use time-restricted but not prolonged feeding to reduce late-night intake. Circadian-aligned eating schedules can stabilize metabolism, increase protein per meal to improve satiety and lean mass support. This helps appetite regulation without long fasting. Reduce ultra-processed carbohydrate intake to normalize post-meal insulin. Lower variability supports metabolic flexibility. Regular meal timing can deliver many benefits of fasting structure. Pair with sleep, protein, and training for comprehensive support. Metabolic health can improve without extended fasting periods. Choose the path that fits your physiology. Health outcomes are driven by physiological compatibility, not dietary ideology. Health outcomes are driven by physiological compatibility, not dietary ideology. Intermittent fasting should be personalized, not universally prescribed. Depends on physiological context, varies between individuals, and reflects metabolic signaling. Identify personal tolerance. Start moderate, monitor signals, and adjust duration. Avoid aggressive windows. Pair training with fueling, and prioritize sleep and recovery. Consider structured eating, high-protein meals, circadian alignment, and less ultra-processed carbohydrate. You explored intermittent fasting benefits and risks, and who should not do intermittent fasting. We reviewed metabolic flexibility explained and the fasting and cortisol relationship. We addressed fasting and thyroid function and why fasting stops weight loss in some contexts. Sustainable strategies must align with individual biology. Evaluate your response, rather than imitating protocols. We will explore personalized metabolic approaches in future content. If this was helpful, consider watching our guides on circadian rhythm and metabolism and safe fasting duration.